Well, we're here with Dr. Mahoney, medical doctor who basically specializes in getting rid of pain, of heavy pain, pain which sometimes other doctors cannot get rid of it. Dr. Mahoney is in Southlake, in Texas, which is between Fort Worth and Dallas. Hi, Dr. Mahoney.
Hey, how are you?
Good. Dr. Mahoney,
good.
Tell me, what makes a guy like you being specialized in pain? Isn't every doctor specialized in pain? Isn't that why we go to any old doctor?
It's a great question, because more patients come to doctors for pain than any other reason. So if I'm going to treat a patient at all, most of them will have some kind of pain. That's what the body tells you about what's wrong with it. It's going to give you pain, and that means you better go see your doctor. And frequently people don't want to take pain medicine or narcotics, so they come to see me to find out why they have pain. And that's my job, is to find out why and then fix it.
I see. So are you telling me you're not necessarily fixing the pain with pain medication and narcotics?
No, there's doctors who do nothing but that, and they're very qualified to do that, and if patients choose that, it's a reasonable option if that's what they want. But my theory is that there's reasons for pain that are much bigger than just taking pain medicine. It's more about, why does your body struggle to function without causing you pain? Because a healthy person doesn't have pain. So that's what we try to do, is try to figure out where their health is not perfect and their body creates pain. And we interact with that hormonally, emotionally, whatever way we need to. We use acupuncture, all sorts of different therapies, injections we learned in Germany, and we help people get better from their pain in different ways than just using medicine or injections with drugs.
I get it. Because, I have in my work encountered many pain specialists, and frankly, most of them, and I thought that's what you do also, most of them, the way to get rid of the pain is with a heavy dose of narcotics, I guess, whatever that then might be, and then, then you simply have no more pain. But what you say is that's not quite what you do. You look at the more underlying cause of what might be wrong. So a guy might have headaches, but his headache may not come from the head.
Absolutely.
Or something like that.
Well, as a trained osteopathic physician, I can put my hands on someone's body and create changes in the way that their body functions so that the pain signaling from the rest of their body doesn't stimulate a headache. And we use nutritional support like magnesium to make the blood vessels relax. So even in real bad pain like migraine, you can make a patient much better by using natural substances and natural treatment and acupuncture and those kinds of things in a way that's very, very different than the traditional approach using pain drugs like narcotics. And I really like that, and I think our patients are well served to not be doped up. And instead, they're hoped up, and we give them hope that they can get better and stay better.
Well, I have heard a saying from somebody that, we are never born with a chemical deficiency in our bodies. So why the hell would we want to put that stuff in it afterwards?
That's right. It's not a narcotic deficiency that's causing the pain. You're right.
Yeah.
So.
Now, however, what would make a patient come to you, a full-trained physician, and you used a word which I can't even pronounce, what was that word you used?
Well, it's not an Austrianopathic, as you might think. It's an osteopathic doctor. Osteopathic doctor.
Okay.
Osteopathic doctors are trained to look at the structure of the body and how the nerves work through that structure to create the experience of life. Just the joy of looking at things and tasting and feeling and all those things, because that's all directly dependent on the way that the body processes that information through the structure and through the nerves. On top of that, we're trained just like a traditional MD doctor. We take all the same courses, read all the same books, take all the same tests, and in Texas, where I'm located, we are under the same medical board. As an osteopath, we have osteopathic medical care, which is slightly different in some cases, but in mine, dramatically different. I like to look at acupuncture, osteopathic manipulative treatment, which is somewhat like chiropractic, but it has its own special flavor, and looking at all the different ways that nutrition and diet and activity impact the experience of life, including pain.
Okay. So
there you have it.
There I have it. So a person being inclined to do what could be a natural alternative healthcare like the acupuncture, the chiropractic, the vitamin, the nutrition, that type of stuff. What would be the advantage of a person like that coming to a full-trained MD like you versus to go through those specialties like chiropractor or physical therapist, nutritionist, and etc.?
Oh, Mr. Flash, you have so much to learn. I'm a DO, not an MD. And a DO, I'm a James J. Mahoney DO. A DO is a doctor of osteopathy. An MD is a medical doctor only. They don't take the same training in structural medicine. And the reason that they would come to see me is because I'm different than that. Because I don't look at drugs and surgery as the first choice. And if you look at the medical literature, they say in the literature of all the trained physicians in the United States, including MDs and DOs, 16% or so understand nutrition and natural health. If you ask patients, somewhere between 75 and 85% of patients understand the value of natural health and nutrition and those activities. So people will come to see me because that's what they want. They're not looking for drugs. If they want drugs, they know where they can go get them. If they want something special in terms of that kind of treatment outside of medication alone, they'll come to see me. I can prescribe medicine, I can prescribe narcotics, and do all those things and do it well, and I'm well trained to do it, but I choose to use that as my very last resort. So it may be 5 or 10% of the people I see or less, they might need narcotics, and it's okay. There's no sin in that. It's not evil. It's just should not be your first choice if you're looking for someone like me to treat you. So that's why.
So looks to me, if I can summarize that from my understanding, it's the people who are looking for alternative health care and for natural cures, they would be well served to go to a guy like you who understands medicine in its fullest. So basically, you get the best of both worlds. If medicine is a resource, he can and should do it, rather than, let's say, a normal everyday chiropractor, which with no doubt has is huge value. But at the same token, he's not a total MD. So basically, you got what he knows and you got what they know, and then you mix it up the way you feel it's the best for that particular patient.
You make me laugh. I think about, just as you said that, I thought the best example is if you want to make a little kid happy at Christmas time, you don't buy him a simple pocket knife. You buy him a Swiss Army knife because it has all the tools on it. It has everything. And my degree and training makes me kind of the Swiss Army knife of doctors. I can do structural medicine. I can do treat with medication. I can do acupuncture. I've been trained internationally by German physicians and Italian physicians to do injection therapies that typically are not done by the average doctor in the United States because they're not taught that in medical school. You have to get that after medical school. And it's really a funny picture in my mind. The Swiss Army knife of doctors is kind of what kind of doctor I am and my colleagues who are osteopaths like me.
The Swiss Army knife of doctors. This is wonderful. I love it. Well, I hope this video, and I'm sure it is informative to people watching out there, because I think that's what us patients really are looking for. We don't want to go to a carpenter who only knows how to work with wood. We don't want to go to a metal guy who only knows how to work with metal, or to a guy who only works and weaves baskets. If we want a shelf mate, we want to have somebody who knows how to weave baskets, work with wood, work with metal, and basically will put us in it what A, we like, and B, we really need. And that seems to be you. That seems to be a DO. That seems to be that perfect combination. Thanks a lot, Dr. Mahoney.
Thank you, Mr. Flash.